My name is Keith Prowse. I'm a consultant chest physician and I'm chairman of the British Lung Foundation. COPD means chronic obstructive pulmonary disease, which is a rather extended way of saying it's a chronic condition that affects the lung tubes, the air tubes, and the lung tissue itself, probably better known to people in the past as chronic bronchitis and emphysema. The main symptoms of COPD are cough, particularly in the early morning, or what's sometimes called a smoker's cough. Coughing up mucus is the next thing that follows, and the condition is defined clinically by coughing up mucus every day for 3 months of the year, usually in the winter. Breathlessness on exertion comes later, and usually obviously initially on exercise, walking up hills, but it can progress and eventually people can become very seriously disabled by it. If I thought I got symptoms of this condition, I'd go along to my GP, tell him about them, and hopefully he'd arrange a chest x-ray, which excludes a lot of other conditions. He'd probably do a simple blowing test to measure what my lung function is compared to average. And then he would probably prescribe either an inhaler to open up the air passages when I get spasms or coughing, an inhaler to cut down inflammation, which you get when you get infections and other things, and possibly also an emergency supply of antibiotics so that if I get an infection, a chest infection, I've got something I can treat it immediately. I'm not waiting to get a prescription.
And there's very little air trapped within
The main cause is cigarette smoking, but it can be caused by exposure to fumes and dust at work. It can be caused by exposure to air pollution, and it can be caused by some chemical exposures. So there's an awful lot known about the cause. What we don't know at the moment precisely is what takes some people to get it and why other people don't. The British Lung Foundation has been very active because we know that a lot of people have this condition, but many of them don't consult their doctors and many of them don't even know. When we've done surveys, and I mean by that going out into a shopping centre and measuring people's function, we find that up to a third of people have abnormal function. Most of those are smokers, the commonest cause is COPD, and most of them don't know about it. So there's a huge hidden collection of people, what we call the hidden millions. There's about 2 million of these people, and not getting appropriate advice and treatment. But if we can take action early, then we can prevent a lot of that disability. And the two key actions are to stop people smoking or stop their exposure to smoke, and secondly to get treatment, both to help the tubes to keep open, to help to clear mucus, and particularly to deal with or prevent infections.